What if I told you that the reason you drift when you walk, that subtle pull to one side, that weird little pause before your body decides which way is straight, has nothing to do with your legs at all? And what if the real issue is something happening up in your neck right now, something most people never get a clear explanation for? Because here is what I see happen all the time. Somebody starts drifting when they walk. They grab the wall when they stand up. Their body hesitates in ways it never used to. They go to the doctor and hear the same old lines. Be careful, hold the railing, maybe it is just getting older. So they go home, try a few leg exercises, and nothing really changes. The drifting keeps happening, the hesitation keeps happening, and eventually they just accept it like it is part of life now. I am here to tell you it is not inevitable. I am going to break down exactly what may be going on inside your body in plain, simple language. And then I am going to walk you through 8 exercises that target the real problem directly. No gym, no equipment, just a wall, a chair, and less than 12 minutes a day. Before we jump in, if you have not subscribed yet, go ahead and hit that button and turn on the bell so you do not miss any more health tips made for people who want to stay steady, strong, and independent. And if you are enjoying this video, type 1 in the comments. If not, type 0 and let me know how I can make the next one better for you. So what is actually happening in your body? Here is the part most people never hear explained. When you start drifting while walking, the problem is almost never just your legs. At the base of your skull sits a structure called the cerebellum, which is basically your brain's balance command center. Every single second you are upright, it is taking in signals from your muscles, your joints, your inner ear, and your eyes, and using all of that information to make tiny corrections that keep you moving straight. When it is working well, you never even notice it. You just walk. But when it starts running at less than full capacity, that is when the drifting begins. That is when you start reaching for walls. That is when every step feels just a little bit off. And here is the part that changes everything. The arteries that carry blood to your cerebellum travel through the bones in your neck, one vertebra at a time. So when those neck muscles get chronically tight from years of posture habits, old injuries, tension, or just the way you hold yourself every day, they can quietly compress those arteries and reduce the blood flow reaching your cerebellum. Not in some dramatic, obvious way, usually not enough to make you collapse, but enough over months and years to slowly chip away at your balance and coordination. That is the real mechanism. And if you want to improve it, you have to address both sides of the problem. Release the restriction in your neck and retrain the cerebellum directly. That is exactly what these 8 exercises are designed to do. We are going to work in 2 groups today. Group 1 releases the neck tension. Group 2 retrains your cerebellum. You need both. They work together. Let us start with Group 1, the neck release exercises. Exercise 1 is the base of neck rotation release. Why this matters is simple. The junction where your neck meets your upper back is one of the 2 areas most likely to build up stiffness that can compress the arteries feeding your cerebellum. This movement gently opens and mobilizes that exact zone. Here is how to do it. Sit in a sturdy chair with your back straight. Gently lower your chin slightly toward your chest. Place 2 fingertips against the bony bump at the very base of your neck, right where the neck meets the upper back, that prominent vertebra you can feel there. Slowly rotate your head to the right while using your fingertips to apply a very gentle guiding pressure in the same direction. Move only as far as comfortable. You want a mild stretching sensation, never pain. Hold that easy end point for 3 to 4 seconds. Slowly return to center. Then repeat on the left side. Do 5 repetitions on each side. Practice this once in the morning and once in the evening. A lot of people notice their range of motion gradually improving over the first 1 to 2 weeks as the stiffness starts to let go. Exercise 2 is the side neck stretch. Why this matters is that the large diagonal muscle running from behind your ear down to your collarbone is one of the most chronically overworked muscles in the body. When it stays tight, it puts sustained pressure on the structures running through your cervical spine, including the arteries feeding your cerebellum. Here is how to do it. Place one hand flat against your collarbone on one side and press gently downward to anchor the tissue. Slowly tilt your head toward the opposite shoulder and lift your chin just slightly upward. You should feel a clear, deep stretch running along the side of your neck. Hold it for 20 to 30 seconds, breathing slowly and steadily. Do not yank it. Do not force it. Let gravity and time do the work. Come back slowly to center and repeat on the other side. Do 2 repetitions on each side per session. Exercise 3 is neck self-massage. Why this matters is that stretching releases muscle length, but massage helps release the deeper tissue tension that builds up over years and often does not respond to stretching alone. This is the kind of tension that can quietly narrow the space around those cervical arteries. Here is how to do it. Using the fingertips of both hands, start at the base of your skull and apply firm circular pressure as you work slowly down both sides of your neck toward the base. Spend about 60 to 90 seconds on each side. Look for spots that feel noticeably tighter or more tender than the tissue around them. Give those areas a little extra attention, not by digging in painfully, but by applying steady, gentle pressure until the tissue starts to soften. Do this once a day, ideally in the morning, before or after the other 2 neck exercises. Now let us move into Group 2, the cerebellum training exercises. Exercise 4 is the slow motion straight line walk. Why this matters is because before you can retrain your walking pattern, you have to slow it down enough for your brain to consciously register and correct each step. Slow motion walking strips away the momentum that normally hides weakness and forces every muscle and every balance signal to work with full intention. Here is how to do it. Find a clear hallway. Place one hand lightly on the wall if you need support to get started. Begin walking at the slowest pace you can manage, so slow that each step takes a full 3 to 4 seconds to complete. Lift your foot deliberately, pause for a moment in the air, reach your heel slightly forward, and lower it to the floor with full control. Feel your weight shift through your foot before you take the next step. Walk 10 steps forward. Turn carefully using small marching steps. Then walk 10 steps back. That is 1 set. Complete 3 sets. What should you focus on? Keep your eyes straight ahead, not down at your feet. Your balance system needs to work while your eyes are focused on where you are going, not on where your feet are landing. And the wobble you feel during this exercise is your cerebellum working hard. That is not a bad thing. That is the entire point. Here is a progress tip. Once this starts to feel smooth, try doing it on carpet versus hardwood. That slight change in surface forces your nervous system to adapt and generalize the pattern, which is exactly what you need for real-world safety. Exercise 5 is the tandem heel-to-toe walk. Why this matters is because it directly simulates the kind of walking that can be the trickiest: narrow hallways, stepping carefully around furniture, moving through tight spaces, all the situations where balance matters most. It trains dynamic balance, which means your balance while you are actually moving, not just standing still. Here is how to do it. Stand at one end of a clear hallway with one hand lightly touching the wall. Place your right foot directly in front of your left, so the heel of your right foot nearly touches the toes of your left. Then step your left foot forward in the same way, heel to toe, in a perfectly straight line. Take 10 steps forward. Turn carefully. Then take 10 steps back. That is 1 set. Complete 2 sets. What should you focus on? Keep your eyes forward, not down at your feet. Walk slowly and with control. If you need to touch the wall for a moment, that is completely fine. Touch it, reset, and keep going. Consistency matters way more than perfection here. As this gets easier, you can try it with your arms crossed over your chest instead of stretched out for balance. That removes the arm compensation and forces your core and ankles to do more of the stabilizing work. Exercise 6 is standing marches with a cross-body tap. Why this matters is because it builds 2 things at once: the hip flexor strength you need to lift your feet clearly off the ground with each step, and the cross-body coordination that is one of the cerebellum's most important jobs. Cross-body movement activates the neural pathways between the 2 halves of the brain, and that is essential for smooth, coordinated walking. Here is how to do it. Stand tall behind a sturdy chair with both hands lightly resting on the back. Lift your right knee toward your chest as high as you comfortably can. As your knee rises, tap it with your left hand. Lower the right leg with control, then lift your left knee and tap it with your right hand. That is 1 repetition. Do 10 repetitions on each side, 20 total. Move slowly and deliberately. The tapping hand and the rising knee should meet at exactly the same time. That timing is what trains the cerebellum. Once this feels comfortable, try it without holding the chair and keep your arms extended to your sides instead. Eventually, you can even try 2 or 3 reps with your eyes closed to make the challenge a little deeper. Exercise 7 is the fixed point turn. Why this matters is because dizziness and disorientation during turning movements, like pivoting in the kitchen, turning to look behind you, or getting up and changing direction, is one of the most common triggers for falls later in life. This exercise trains exactly that skill by forcing your visual system and your vestibular system to work together during rotation, which is precisely the kind of coordination the cerebellum struggles with when its blood supply is not ideal. Here is how to do it. Stand facing a wall with a sturdy chair or countertop nearby. Pick a fixed point at about eye level, a light switch, a picture frame, any clear mark on the wall. Lock your gaze on that point. Now take 3 slow steps and do a complete 360-degree turn. During the turn, keep your eyes locked on that fixed point for as long as physically possible. The moment the turn is complete, find that same point again immediately. Do 5 full turns per session. Start very slowly. As this gets easier over the weeks, gradually increase the speed of the turn. What should you focus on? Do not close your eyes on this one. The entire benefit comes from the active coordination between what your eyes see and what your inner ear feels during the rotation. Stay close to the wall, especially during the first week. Exercise 8 is multi-direction weight shifts. Why this matters is that most falls do not happen when you are simply walking straight ahead. They happen when you reach sideways, turn a little too quickly, or shift your weight in a way your body was not expecting. This exercise trains your ability to move your center of gravity in multiple directions and recover back to center, which is the core skill your body needs to catch itself before a stumble turns into a fall. Here is how to do it. Stand behind a sturdy chair with both hands resting lightly on the back. Keep your feet hip-width apart and your back straight. Slowly shift your weight to your right foot, lifting your left foot just 1 inch off the floor. Hold it for 3 seconds. Return to center. Then shift to your left foot, lifting the right foot just 1 inch. Hold it for 3 seconds. Return to center. Now gently shift your weight forward onto the balls of your feet, just far enough to feel the challenge without your heels leaving the floor. Hold for 3 seconds. Return. Then shift gently backward onto your heels. Hold for 3 seconds. Return. That whole sequence, right, left, forward, back, is one complete round. Do 3 rounds. As you get stronger, reduce your grip on the chair little by little, from full hands to fingertips only to no support at all. Every step down forces your ankles, hips, and core to take on more of the stabilizing work. Now I want to pause for an important safety note before you begin, because your safety matters more than anything here, and I would never want somebody to get hurt trying to follow along. First, these exercises are meant for general use by healthy older adults. If you have been diagnosed with a neurological condition like Parkinson's disease, have a history of stroke, or have been told by a doctor that you have significant vertebral artery disease or severe cervical instability, please talk to your physician or a licensed physical therapist before trying any of these movements. Your situation may need a modified or closely supervised approach, and that is completely okay. Second, for the neck release exercises specifically, never force any movement. The stretches and rotations in Group 1 should always feel like a gentle, mild pull, never sharp, never pinching, never accompanied by dizziness or tingling down your arms. If you feel any of those things, stop immediately and check in with your doctor before continuing. The neck is a sensitive area, and patience will do you a lot more good here than pushing too hard, too fast. Third, for the balance and walking exercises in Group 2, always have something within reach before you start. A wall, a sturdy chair, a countertop. It does not matter which one, as long as it is there. And that is not because I expect you to fall. It is because having that safety net nearby lets you train with more confidence and less tension, which actually makes every exercise more effective. Fourth, never do these exercises in socks on a hard floor. Socks on smooth surfaces are one of the most common ways people slip at home. Go barefoot if you can. That is actually ideal for balance work because it gives your brain more sensory feedback from the ground. If you prefer footwear, pick shoes with a non-slip sole. Fifth, and most importantly, if at any point during any of these exercises you feel sharp pain, sudden dizziness, the room spinning, or anything that just does not feel right, stop immediately. Do not push through it. There is no movement here worth risking an injury over. Go at your own pace, progress on your own timeline, and let your body tell you when it is ready for more. That is how lasting change gets built. So how do you fit all of this into a normal day? Here is the simplest routine. Every morning, spend 5 minutes on the 3 neck release exercises: the rotation, the side stretch, and the self-massage. Think of that as opening the pathway so your cerebellum can get what it needs throughout the day. Then, at any point during the day, even in short 2-minute bursts, work through the 5 cerebellum training exercises. The slow motion walk and heel-to-toe walk can be done in any hallway. The marches, turns, and weight shifts can all be done in a small space next to a chair. The whole routine takes less than 12 minutes total, and it works best when it is done consistently, a little bit every day, instead of in long sessions once or twice a week. Do not skip the days when you feel steady. Those are actually some of the most important days of all. Every repetition builds the neural pathway that fires automatically the next time your balance gets challenged. You are doing the work now so your body can protect you later in that split second when it matters most. And here is the part I really want you to hold on to. The drifting, the wobbling, the reaching for the wall. None of that has to be the final chapter. Your cerebellum has not given up. It may simply need better input, better blood flow, and better daily practice. When you give your brain the right challenge consistently, it can respond slowly, quietly, and steadily. Before you leave this video, remember this. The people who improve the most are not always the ones who push the hardest. They are the ones who show up every day, even when it feels like nothing is changing, because the brain often gets better before you can feel it. New pathways are being trained. Old signals are being reawakened. And then one morning, you walk across the kitchen and realize something important. You did not reach for the wall. You just walked. So start small today. Do the neck release. Try the slow motion walk. That is enough for day one. Then add one more exercise every few days. Your goal is not perfection. Your goal is to teach your body one careful repetition at a time how to trust the ground again. Give yourself 6 weeks of steady practice and you may begin to notice more control, more confidence, and more trust in your own steps again. And please do not keep this to yourself. If you know somebody who grabs the counter when they stand up, avoids walking outside, or feels nervous turning in the hallway, share this video with them. This simple information may help them feel safer, steadier, and more independent. One more thing before you go. Balance is only one part of fall prevention. The next piece is leg strength. Even when your balance improves, your legs still need the power to catch you in that split second when it matters most. That is why I made a separate video on safe leg strengthening exercises for people over 70. No gym, no equipment, easy to follow at home. That video is on the screen right now, so click it next and I will walk you through it step by step. If you enjoyed this video, please leave a comment with 1. If not, feel free to comment with 0. Your feedback means a lot to us. Do not forget to like, share, and subscribe to our channel for more content like this. Thank you for watching, and here is to living life on your own terms.